Hello and welcome to Winter Grace Senior Ministries. I am Debbie Bergio and I am joined today by Katrina Wolf. Katrina is the owner of Age Well Senior Fitness, and we are just so glad that you are here with us today.
Thank you for having me, Debbie. I'm glad to be here.
So Katrina, tell us please about Age Well Senior Fitness, how it came to be, what we can expect if we get to be working with you.
Sure. Age Well Senior Fitness provides in-home and virtual personal training sessions. We specialize in clients over 55, but we really specialize in people with health conditions such as Parkinson's, stroke, COPD, congestive heart failure, even dementia. We can work with dementia clients. Myself and all of the trainers that work for me, they are certified personal trainers, but they are also experienced rehab professionals, either physical therapists or physical therapy assistants. So we don't provide physical therapy, we provide personal training, but we have the background to know what to do with people who have special health challenges. So we're a great service to have, like after you've had physical therapy and you've been discharged and you want to continue to make gains or continue to keep the gains that you've made during therapy.
I know personally, I've gone to physical therapy and said, oh, I'm going to do these exercises forever. And that lasts about 2 weeks. And
yeah,
so
yeah, when you have someone show up at your house and say it's time to work, it's a little more motivating. So sometimes we come in just for accountability. Some people know that having someone show up will help. Oftentimes our services are facilitated by caregivers, children or spouses who know that their loved one needs to be more mobile, needs to improve their balance and strength, and they're concerned about them being at home. So we're the ultimate aging in place service.
That really is. It's really great to know, because I'm familiar with home health care and the nurse visits and everything like that, but to have an in-home personal trainer. So in-home, that just brings up this time we're separated by computer screens because of COVID. How have you adjusted to that?
Well, we had lots of infection control procedures in effect long before COVID. My background is in home health care, so that just came natural to me. Washing your hands when you enter the home, washing your hands when you leave the home, wiping down your equipment after every client. That was stuff that we did prior to COVID. The biggest change for us is wearing the mask. All of our trainers wear a mask in the home. We don't wear gloves. I think gloves are icky. You're better off to wash your hands frequently than to use the gloves. That's my understanding. I've talked with some other professionals about it. And of course, we have guidelines. We take temperatures of all of our clients before beginning the session. My trainers have all signed an agreement that if they are sick or if someone in their household has come in contact with someone with COVID, we don't work. You know, the safety of our trainers and our clients is the most important thing to us, and we want to be here to see you another day. We want you to be here to see us another day. So if we have to take a couple weeks off, then that's, you know, a small price to pay to make sure that everybody's safe. And we ask the same of our clients and their families, if they live with family, if they or anyone in their family have come in contact with someone who's a known COVID case, or if they're ill, to cancel the sessions. We can always refund money, credit it towards future sessions, but the safety is the most important thing.
You're there to help people build their health, not to.
Absolutely.
Counterintuitive.
And we do virtual sessions as well for people who just really do not want to have anyone in their home. We do still offer virtual sessions, but I will say we went to all virtual during COVID and my clients climbed on board, but as soon as I was able to get out, they were like, no, we want you back. So the clients themselves really like the in-home service, but we do offer virtual sessions as well.
Okay, and that's great that you were able to do virtual and can do virtual, because I know this has been a time of decline for so many older adults, and to keep active during that time has been, I'm sure it's been a real gift to them.
Yeah, it's I have one client who lives with her grandson, and I'm the only person that comes and visits. I mean, her other family members won't come, but they want me to go. So, you know, her and I visit and we exercise, and she doesn't particularly like exercising, but she likes me. So, that's her motivation to exercise, is because she gets to see me. She always does what I ask her. She's so lovely, but You know, she's like, oh, this is hard.
Well, you're growing. She's growing.
She has grown tremendously. She was falling several times a week, and she's had 2 falls in the last 3 months. So the progress she made is amazing.
Oh, that is fantastic. So you were saying earlier that you work with patients who have Parkinson's and or dementia or stroke. How does someone begin working with you? What's that process to get them started?
First, they can contact me, and I take an intake. We have a phone number, 240-397-9050. And I talk to the prospective client on the phone and find out what's going on with them. Sometimes I refer people to physical therapy. Sometimes they're in a place where I really think that physical therapy is the better place for them to be. The lady I referenced prior, I referred her to home care PT first, and she had 6 weeks of home care PT, and then they signed up with me. So I like to do that intake process to make sure that we are the appropriate service for them, and if there's something that insurance might pay for that they could benefit from, then I will refer them out to that. After we do the intake on the phone and we have an idea of what the client wants, we make an initial first visit to the home that's free of charge. It's usually me and whatever trainer is going to see them, fill out the awful paperwork that you have to fill out whenever you have to do anything. If necessary, I get a medical release from the doctor. Not everybody needs one, but some people, if they've had a stroke or congestive heart failure or COPD, I definitely get a medical release for them. But if they're otherwise healthy with no risk factors, then we don't need to do that. And then they get started. Our sessions are 45 minutes long. We take vitals at each session and temperature. And our sessions generally comprised of some sort of balance activities or balance training, and then strengthening as well.
Okay. So this seems to me, and it just may be me, a very niche service, a very specific. Is that what sets you apart? I mean, is it a unique service in the area?
Yeah, the name of the business is AgeWell Senior Fitness, but in 16 years of home care, I saw such a hole of need in the market. I would discharge people from physical therapy, and they would ask me if I could come back and see them and pay me cash. And as a PT assistant, I couldn't do that. But they don't have a skilled need. They don't need physical therapy. They just need to exercise. And as a personal trainer, we can work on balance and strengthening. They've been discharged from therapy. If they need therapy, that's where I send them. So I just saw such a need in the community. If you have a healthy 60-year-old or 70-year-old, they can be served in so many places. The senior centers, when they're open, there's so many avenues for them to go to get, help with exercise. We can serve them as well. Sometimes we have people that have back problems and they want someone who knows a little bit more, or the senior center exercises are bothering them. What else can I do? So we can serve those people as well, but I really see there's nothing else that I know of that helps people that are homebound and with medical conditions to help keep them safe and mobile in their homes.
I was telling you before we started recording that I wish my mom had met you about 10 years ago. And you were saying your ideal client is, can you describe your ideal client to us?
My ideal client is probably between 70 and 100. They probably use an assisted device to walk. Maybe they have a history of a fall or two, and maybe they're just finishing up with physical therapy, or they've had physical therapy in the recent past, and they want to either continue to make gains or to maintain the gains that they had in PT. PT services are so limited by insurance now. They don't have the time to work with them that it takes to really improve strength. It can take a long time to really make significant gains in strength. So that's where we come in. We can take the time that you need to progress the exercise program. That's the other thing. Working with the most effective exercise program is one that is progressed. So doing the same exercises over and over and over again, and never increasing your repetitions, never increasing your weight, will help you maintain. It will not help you progress. So a progressive exercise program is what the research shows helps reduce falls in the elderly and helps improve their mobility.
And reducing falls is such a key for longevity and mobility.
Absolutely. And staying at home,
And staying
staying
at
in your
home,
own home.
absolutely. All of this information about how to contact Katrina and more about her business is going to be below this interview on the webpage. But also very exciting, on October 7th at noon, Katrina is going to be on a panel with 2 other folks who are going to be sharing their expertise. And if this is before October 7th, please, if you're watching this before October 7th, please register. And if not, the recording is going to be here too. So just really excited, Katrina, that you're a part of our event. And
Thank you. I'm excited to be a part of it. Prevention. I mean, the topic is, preparing for aging.
Mhm.
Like I said, if I could get people before they got to the point where they were with a walker and had 2 falls, that would be ideal.
Absolutely. Katrina, thank you so much. And we will talk soon.
Thank you, Debbie. Thanks for having me.
Have a great day.